In this session, we will be seeing the basic positions that we have to provide to the patients with any alteration in immobility in order to provide more comfort. And also in immobile patients, while providing these much positions, there is a lot of risk factors, like there is a lot of chance of getting contractures of several joints, or the inadequate flexion or extension, or unnecessary flexions and all. So in order to maintain a particular normal body alignment while patient is in such position, what all things we have to keeping in mind and what things we have to do. Okay. So we can see each position in detail. I hope this name of the positions and actually what it is already described in the class of comfort, I think, in positions and all. So it will be easier for you to understand more. So let's see the first one, that is Fowler's position. So while the patient is in Fowler's position means semi-sitting position. It is a semi-sitting position, and head of the bed is elevated to 45 to 60 degrees, and the knees slightly elevated. Knees will be slightly elevated because this is in order to prevent the fall from the sitting position. Okay. So there is some of the possible complications that must be prevented. So that means when a patient is in a Fowler's position, if the mobile patient is maintaining in a Fowler's positions, if we are continuing this particular position for several hours or time, and we are not treating properly, means there are a lot of complications that may happen, like flexion, contracture of cervical spine, exaggerated flexion of lumbar spine, dislocation of shoulders, flexion of contracture of wrist, finger contractures and thumb abduction, external hip rotation, hyperextension of knees, foot drops. Okay. So in order to prevent these complications, what all preventive actions that may be taken? That is, for flexion contracture of cervical spine, we have to rest head directly on mattress or support with small pillow only. Okay. Then the second complication is exaggerated flexion of lumbar spine. So here we have to provide firm support to the back, pillow to support the lower back. So the lower back should be supported with a soft pillow. In case of dislocation of shoulder, that can be prevented with elevated forearms on pillow to avoid tension on shoulder. So we have to elevate our arms that can be supported clearly, so that what will happen? We can avoid the tension on shoulders. Then the flexion contracture of wrist. For that, we have to support hands on pillows to maintain natural alignment. We have to support the hands on pillows. Then finger contractures and thumb abduction. So we can use hand wrist spleen. Then in case of external hip rotation, we can use trochanter roll. I hope you have studied what is trochanter roll in comfortable devices. Then hyperextension of knees. In order to prevent that, we can flex the knees with a small pillow under the thigh. So under the thighs, we can place a small soft pillow so that we can attain a slight flexion over the knees. And foot drop otherwise known as plantar flexion. So here, in order to prevent this foot drop, we have to maintain dorsal flexion with footboard or high top tennis shoe. That is, foot supporters. A board can be placed so that we can prevent the foot drop. Okay. Now the second position, that is dorsal recumbent position. Otherwise, this other name of this position is supine position. This is one of the normal position we are maintaining. Okay. So it is a backlying position. Head and shoulders may be slightly raised. Head and shoulders may be slightly raised here. That is according to the comfort only. Okay. So the cervical hyperextension, that is one for the first complication that may happen if we are sustaining with this supine position. So in order to prevent that, we have to maintain correct alignment with pillows under upper shoulders, neck and head. Sometimes what will happen means, while in sleeping, the pillow will be placed only on at the back of the head only. So we are forgetting to support the head as well as the shoulders. So while placing a pillow under the head area, we have to support the shoulders as well as the neck along with the head. Okay. posterior flexion of lumbar spine may occur. In order to prevent that, small pillow or roll can be placed under lumbar curvature. Then claw hand deformities, that is extension of the fingers and abduction of the thumb. In order to prevent this thing, we have to use hand wrist splints. Okay. Then this splint, everything will be studied in the first aid unit. Okay. Then hyperextension of knees. Hyperextension of knees may happen. So in that, pillow under lower legs from below the knees to ankle, or small pillow under the thighs to slightly flex the knees. This is the thing we have to keep in mind. Now again foot drop may happen, that is plantar flexion may happen. In order to prevent that, we have to maintain dorsal flexion with the footboard or high top tennis shoe. Again, in order to prevent foot drop, whatever be the cases, we have to use this intervention like dorsal flexion we have to maintain with footboard or high top tennis shoe. Okay, so in this that will be supporting the sole along with the ankle. Okay. Now, this is the third one, that is prone position. In prone position, the patient's face will be down in a down position and head is turned to one side. Otherwise, the patient will be having respiratory difficulties. Okay, so the face must be turned to one side and face should be face to the down position. Here, the patient may experience cervical spine flexion. So what we have to do is small pillow under the head have to be placed. Then hyperextension of spine, respiratory impairment may happen. So small pillow just below the diaphragm we have to keep. Then again foot drop may happen. So we have to use what? Allow the feet to dangle over end of mattress or place lower leg on pillow to keep toes from resting on bed. So we have to elevate the toes. Okay, by using pillows. Now lateral or the lying position. So here the lateral lying position, that is a lateral aspect of lower scapula and lower ilium support most of the body weight. So that is lateral side lying position. So when in this position, patient may have lateral flexion of neck. So in order to prevent this, pillow under the head and neck we have to keep. Then in order to prevent the internal rotation of arm, limited chest expansion leading to respiratory impairment. So in that we have to maintain alignment of upper arm with pillow underneath, slightly flex the lower arm. Okay, so that by this we can prevent the internal rotation of arms. Now extension of fingers and abduction of thumbs. In order to prevent that, simply we have to use hand wrist splint. Now internal rotation and abduction of femur may happen. Internal rotation and abduction of femur. In order to prevent that, the pillows to support leg from growing to foot can be placed. Then twisting of spine may happen. In this, we have to align both the shoulders with both hips. Okay, so alignment should be proper. Now same position. So here it is a semi-prone position. Upper arm is flexed at shoulder and elbow while lower arm is positioned behind client. Both legs flexed in front of the client with more flexion in upper leg. So lateral flexion of the cervical spine may occur. So we have to support head with pillow unless drainage from mouth is necessary. Then damaged nerves and blood vessel of lower arm axilla. So we have to position lower arm behind and away from the back. Then internal shoulder rotation and abduction may happen. So in order to prevent that, we have to place a pillow between chest and upper arm. Now, internal rotation and abduction of hip and leg or lumbar lordosis may happen. To prevent that, pillow under upper flexed leg from growing to foot can be placed. Then in order to prevent the foot drop, again we can use sandbag to dorsiflex lower foot. That is, foot drop management is same in all conditions. So these are the major positions that we have to keeping in mind, and the characteristics that we have to maintain, and the preventive actions that we have to carry out in order to prevent certain complications that we have seen already in Fowler's, dorsal recumbent, prone, lateral side and SIMS. Okay.